Thank you very much. Welcome to this meeting of the Cabinet. The meeting is being held remotely and members in attendance via a video conferencing link. The meeting is being live streamed and will also be available to repeated viewing. I'll begin by naming the members in attendance for the public record. During the meeting, if a member wishes to speak, they will indicate this to me and I will call them to speak in turn. I would like to remind members that the County Council standing orders continue to apply, to please keep your microphone muted unless you've been called to speak, and that you may be visible on the screen to the public and to other members even when you're not speaking. The members in attendance are myself, Councillor Keith Manns, Councillor Rob Humby, Councillor Ros Chad, Councillor Liz Fairhurst, Councillor Judith Goralowski, Councillor Edward Heron, Councillor Andrew Joy, Councillor Stephen Reid and Councillor Patricia Stallard. Can I start with any apologies for absence? I'm not aware of any.
I believe all members are in attendance, all Cabinet members, Chairman.
Thank you very much, Kevin. Declarations of interest. Have we any declarations of interest? Councillor Heron.
Chairman, thank you. I wish to declare a personal but non-pecuniary interest in item 10 of this agenda, the Waterside Transport Strategy Update, as an elected member of New Forest District Council, where I hold the Cabinet portfolio for planning and infrastructure. In accordance with Part 5, Paragraph 5 of the Code of Conduct for Members, I have taken advice and I have concluded that this does not preclude me from participating in the discussion or voting on this item here in my role as a Cabinet member of this County Council.
Thank you, Edward. Moving on, confirmation of the minutes of the meeting held on the 9th of February. Any comments on the meeting? Are you all happy for me to sign the minutes? I see no hands objecting. Okay, the minutes are passed. Chairman's announcements. I've just got a couple of things to say. First of all, we continue to see the virus in Hampshire reducing. The figures are now back to where they were in the autumn. They're slightly lower in other parts of the southeast and indeed England, so that the direction of travel is a very good one. And we are very hopeful that the dates specified by the Prime Minister for the various reliefs from lockdown will take place. I'd also like to thank everybody across the community in Hampshire for all everyone is doing to ensure that we abide by the rules on the one hand, and on the other hand, help each other with particular problems we may have during the lockdown period. I'm hopeful that the summer will see a significant relaxation of all the restrictions to our movements and what we do, and more specifically, opening up the various businesses in Hampshire that are so important to our prosperity, and particularly during the summer months, the hospitality industry, and more specifically in terms of retail, those shops that don't actually sell food, that have remained closed now for a number of months. We sincerely hope that our recovery package that we'll be working on with our councils across the county and through the various grant streams that were announced in the budget will help those businesses that have gone through difficult times manage to recover back to their previous prosperity. A couple of other points I'd make. I had a meeting yesterday together with the leader of Test Valley Council, consisting the possibility of a temporary asylum seekers camp at Barton Stacey. What I can say is that whereas that was meant to be up and running in February, if it happens at all, it's going to be later this year. And we have made very strong recommendations to the Home Office that this is not a suitable site until they actually sort out some of the issues involved with it. I'm now more inclined to say that this will not go ahead in the immediate future than I was a few months ago. And finally, before we move on to the rest of the agenda, I will be speaking at the decision that is being taken on the extension of the runway at Eastleigh on the 25th of this month in favour of that runway extension, because I want to see the airport at Eastleigh at Southampton survive and prosper and become the most environmentally airport in the country. Moving on to the next item. We have no deputations, and therefore we can move straight on to item 6, that being item 5, no deputations, and item 6 is the progress report on the County Council's response to COVID-19. Chief Executive John Coughlin.
Thank you very much, Leader, and good morning, members. This, as you know, is the latest in a series of reports that we brought to every Cabinet meeting since the beginning of the crisis, virtually a year ago today. It has been a shorter time between this Cabinet and the last, but even in that short time, there have been some significant developments in the report, which we'll take through with you now. If I may, Leader, I'll give a brief general introduction, then I'll hand over to Simon Bryant, the Director of Public Health, to take you through the public health specific dimensions to the report. And then I'll pick up from Simon again on some of the more specific service related issues, and then we'll both be very happy to take questions. So the report again covers the range of activities that have been going on within the County Council, but also addresses our public health responsibilities in the context of the now well-established Health Protection Board and the leader-led Local Outbreak Engagement Board. The report considers the extent of the progress of the infection, which, as you've referred to earlier, Leader, is now happily moving in the right direction on a number of different levels, and we've tried to ensure that this report contains the latest information, but Simon will give you some further updates on the most up-to-date information, showing the reduction in the rates of infection and the consequent reductions in hospital activity, and most importantly and thankfully, the reduction in the number of deaths, which are tracking both the impact of the lockdown activity, but also the impact of the progress of the vaccination programme, which is going at least as well in Hampshire as it is nationally, and is providing the front line of protection for all of our communities. The other major development since we last had this report before the Cabinet was, of course, the Prime Minister's announcements on the 22nd of February for the roadmap out of lockdown, and that roadmap is described in section 16 in some detail, and we're obviously now well into the end of the first stage of that roadmap, pending the 29th of March developments before we move on further from that, and again we'll take questions on that in due course. If I may, Leader, I'll hand over now to Simon to talk to you about the public health dimensions.
Yes, thank you very much, John. Simon.
Good morning, colleagues. Many thanks. So just to confirm what Chief Executive is saying, so the report does set out the dates on the 5th of March, but just to give an updated data. So our current rate is 36.5 per 100,000. That's our 7-day rate, and that compares to England at 58.7. So that updates paragraph 18. And our range across the districts with Eastleigh currently has the highest rate at 49.4. And as Chief Executive said, the reduction in that rate we've seen as a result of lockdown measures and also the vaccination together. We have now seen a reduction in the mortality rate. Sadly, in the last week recorded, we have 52 deaths. We are below the 5-year average for deaths. So that's good. And that brings our total mortality to 2,703 deaths. So that's great, that's come down, but each death is a tragedy, and we have done all we can to prevent that. So that's where we are with the deaths. With regards to the Health Protection Board, as Chief Executive set out, that's still working well, and we are refreshing our plans in line with the current guidance and the new guidance that's emerging, and the new the formerly called the Contain framework, which sets out the formal details of the the roadmap to coming out of lockdown. In paragraph 26, we set out some of the programmes around testing, which have changed through the pandemic. This cabinet has been informed about symptomatic testing previously. We also talked about asymptomatic testing and the lateral flow devices, which we set up a number of centres around the county, and we're looking at how we use those most effectively. And since the writing of this report, the government also announced a community collect programme at this point for parents of children in school. So any parent can collect a test kit, a lateral flow test kit, and undertake that at home. Our tracking and tracing continues to go well, and we're working regionally to make sure that continues to develop. So that's where we do the contact tracing, and again that has our uptake there around 88% of cases and 87% of contacts continues to be good, and that ensures that we can ask people to isolate and their contacts to isolate. As regard to the vaccination, finally from me, as Chief Executive said, the vaccination has rolled out very well. We've done extremely well in the vaccination, and we're also doing a lot of work as a county council with our partners to ensure that anybody who's not taken up the vaccine, we understand who those groups of people are, and we're able to support that. And again, that is going extremely well. And around, in total, about 37% of the population of Hampshire have had their vaccine, which is positive. And we're working down those cohorts in line with the JCVI, the Joint Committee on Vaccinations and Immunisations criteria going forward. So again, another strong programme that the County Council is playing its strong part in. I'll hand back to the Chief Executive to pick up any other items.
Thank you, Simon. Thank you, Leader. Just 3 or 4 additional issues to highlight for members before any questions may be taken. Firstly, to note that in paragraph 22, the issue of the temporary mortuary provision has been considered again, and that paragraph explains that we are now in the process of decommissioning that provision, probably sometime in midsummer. The provision is still being used, but to a much lower extent now. It proved invaluable during the peak of the crisis, but thankfully we now are in the throes of plans to decommission that provision. Paragraph 40 and onwards talks about the election implications. Obviously, members will have the election to the fore of their thinking at the moment. We are working very closely across all partners in concert with central government to make sure the elections can take place safely. It is a complicated election anyway, because it includes the Police and Crime Commissioner election, and so the returning officer for that election actually has parity or supremacy rather in some of the decision making. We are working closely with the returning officers across all of the districts to make sure that there's proper access to effective PPE, for example, and also we've taken steps to ensure that schools are only used as polling stations as a matter of last resort in accordance with the Secretary of State's request. And so some polling stations have been moved. We will also therefore be taking steps to make sure we're communicating that as clearly as we can in accordance as well with what is said on people's polling cards. We're also issuing public health advice and guidance with regard to safe polling, and that advice and guidance will also affect the counting after the election day, which is likely to take longer according to safe practices. But all of those measures are in hand in a complicated process. 2 service-related issues to highlight from within the report. There are again descriptions from paragraph 45 onwards about the work going on in adults' health and care, particularly with the care sector, particularly with regard to the extension of the clinically extremely vulnerable, and the work that's going on, including some exceptional work to support learning disabled people in the vaccination process as well, which I do think is nationally groundbreaking work and to be commended. And in children's services, alongside the social care issues, we do reference the work around supporting schools. And obviously, since this report went to press, we can report that schools are now well into the throes of the full reopening, in line with what Simon was describing about local testing. And we are aware of very high levels of attendance in Hampshire schools, and again must pay tribute to the work of those schools, which never actually closed, but have been working with children all the way through, while they've also been delivering increasing levels of remote teaching and learning. And thankfully, we're heading more into a steadier state of school attendance, but a challenging summer ahead for our schools, particularly in the context of the exam system. And then finally, the recommendations are as before you in the report, Chairman and members, but within those recommendations, you'll forgive me again for paying reference to the fantastic work of our staff within the County Council, both in terms of the support they're giving to the organisation, but also to their communities as we see our way through this crisis. I'm very happy to take questions, as is Simon, Chairman. Thank you.
Thank you very much, John. Any questions from my Cabinet colleagues? Okay. Well, I would just like to add my own thanks, particularly in regard to the last recommendation about the recognition of the ongoing exceptional commitment and flexibility of the staff of the County Council as the crisis has progressed. I think we've all worked together, which is the main point. We've looked after each other, and I think in recognition of that, the rates in Hampshire are just a little below some of our surrounding neighbours, which is encouraging because it does show that we are all doing what we can to overcome the effects of the virus.
Thank you, Chairman.
Are you all happy with the recommendations? I see no hands. So those are approved. Thank you very much indeed. Moving on to the next item. Item 8, and this is the annual report of the Director of Public Health.
We've got item 7 first.
Sorry, my apologies. Well, we've just done item 6. I should have said item 7, health and social care system resilience during COVID-19. Director of Adult Social Care, Graham Allen.
Thank you, Leader. Good morning, everyone. So this report updates Cabinet on key activities undertaken through the pandemic to maintain safe discharges of people from hospital settings across Hampshire and beyond. More than 7,000 people have been supported to leave acute settings through our services, either return home with additional support, return to a care home setting with additional support, or a temporary admission to a discharge to assess bed-based service. And indeed, since this report was finalised and published, I can advise Cabinet that that number of people supported through these routes is now much closer to 8,000 over the period. Those new discharge arrangements have been implemented, and the report provides a detailed overview of these amendments to the previous operating model and discharge legislation and requirements. Paragraphs 10 to 16 provide an overview of these service types and service changes. Paragraphs 22 to 35 provides more detail of the way in which performance and supporting discharge has been undertaken by Hampshire County Council working with system partners. Also contained in this section is a description of the NHS discharge funding made available by government in response to COVID-19. The NHS discharge funding supports people usually for a period of up to 6 weeks once discharged from acute hospital settings. Local CCG partners have acted speedily and honourably in their use and commissioning of services through this funding mechanism. Whilst there continues to be uncertainty over continuation of this funding into the next financial year, work continues locally with our NHS system partners to secure funding for the changes that we've made to services and the new improved discharge pathways that have been put in place. However, should that funding not be available, sadly, many of the services that we've established through this funding will need to be decommissioned. Some examples of the services we have stood up in the last year in the face of the unprecedented challenge of COVID-19 are given, such as the Clarence unit detailed in paragraph 32 of the report. This facility of 73 beds provides discharge to assess bed-based capacity, as well as acting as a designated setting, that is to say, a safe place for COVID positive individuals to be discharged to directly from acute hospital settings, where their care needs can be best met. Paragraphs 36 to 39 set out some of the opportunities and some of the challenges that we face as we go forward. A key risk is being able to continue to support the wider care home sector as it needs to transition to a new and different future, partly through reduced occupancy in care home settings and also the demands of our population as we go forward. And then finally, paragraph 46 sets out the work underway as we continue to respond to COVID-19 and look forward beyond this year into the next financial year and indeed beyond. And as I've already said, there continues to be uncertainty nationally and locally on the continuation of the discharge funding scheme, which has proved so positive. However, we continue to work with all system partners in anticipation of making concrete these services, certainly in the coming period. And we work in line with the direction of travel outlined in the recent government white paper, Integration and Innovation, working together to improve health and social care for all. Thank you, Leader. I'll pause there, but happy, of course, to take any comments or any questions.
Thank you very much, Graham. Liz, Councillor Fairhurst, do you want to make any comments on that report?
Thank you, Leader. I would just like to endorse everything that's in the report. I'd also like to pay tribute to the staff and of Adults Health and Care who've been able to move so quickly and effectively throughout the whole pandemic. We have done everything, and even little things like our distribution centre. I believe the Lieutenant Colonel who looked at it said it was gold standard at one stage. The 3 centres we set for rapid discharge have been a great success. And if I have one hope at all for the future, is that we will be able to continue working with the NHS in this way, not just because it's better for them, but it's so much better for our residents. It's a sort of wraparound system that enables them to come out of hospital and regain as much fitness and be as independent as possible, as quickly as possible. And I would hope that the funding continues so that we can carry on doing this. Thank you.
Thank you, Liz. I'd just like to support what you've just said. To me, what's happening now in terms of the funding and the way that we're working very much more closely with the NHS, and we believe the funding model that I believe we've got at the moment is the one that should continue permanently, is much closer to the original intention when social care and medical care was split in the way they were a quarter of a century ago. It was meant to be an overlapping service rather than a gap between the two. And I believe that we finally achieved that overlap now, and it would be an awful pity if we went back to the previous system. Councillor Stallard, Patricia.
Thank you very much, Leader. This is a message. This is a question really for Graham. Can I first of all compliment you on the report? It's a very detailed report, but it also shows the extent of the hard work that adult social services and healthcare have put in place. And everyone, as Councillor Fairhurst has already said, everyone is to be commended on that. So will you please pass on my best wishes to all those people involved. But I just wondered, the future, you have said, is dependent upon funding. I just wondered if you were getting any feelings back through from Westminster about the certainty or the nature of that funding, and what feedback have you got from the NHS about their wish to continue working with us in the same way, because it is clearly a successful way of achieving things.
Yes, thank you, Councillor Stallard. So what we know at the moment at a national government level is that the NHS discharge funding technically ends on the 31st of March. So anyone not already on a discharge funding pathway by the 31st of March, sadly, that national money will no longer be available. However, alongside that, what we've got is a very clear sense from our local NHS partners that they view the changes and the additionality that we've been able to put in place and the benefits of the discharge funding. They are as supportive of it as we are as we go forward. So that's why in the short term, I feel relatively optimistic in terms of ourselves and our system partners from the NHS doing everything that we possibly can to ensure that those pathways that we've created and built and amended through our response to COVID continue in the short term. However, I'm also very conscious, and I've seen it in the national media today, that, for example, the NHS Confederation, which represents NHS provider organisations, is calling for a further injection of £8 billion into the NHS in order to support recovery through elective surgery programmes, for example. So there's no two ways about it. Despite the intent and the wish for us to continue collectively, locally, to work in this way, the system remains under huge financial strain and indeed competing demands. So we go forward having the best of intentions, but ultimately it will boil down to that money continuing to be available to maintain all of these key services.
Thank you, Graham. Councillor Reid, Steve Reid. Microphone.
Thank you. I'd like to endorse the point that officers have been making. We made huge progress because we had to during the COVID crisis in terms of tackling what used to be colloquially called bed blocking. And there wasn't a solution, and all of a sudden when it had to be done, there was a solution, and it was a very good one. I would like to see that solution, places like Woodcote Lodge, I think I was talking with Liz earlier, continued and expanded across the county, because the benefit to the hospitals is going to be colossal, as well as the benefit to the patients. So if it helps, Graham, in your negotiations, go for this one, because we don't want to go back to old normal.
Yeah, I think we're all in agreement over this. The fact is that with the pressure on the acute hospitals, which is bound to carry on past COVID because of the build-up of waiting lists for elective surgery, surely it must be sensible to use the money that's available either to keep people out of acute hospitals in the first place, or to ensure that they don't stay in longer than they really have to. And those are both areas where we've seen, if anything, a relative reduction in health funding, which has tended to be focused on the acute hospitals in the past. And that is, to me, short-termism. We should be looking in the medium and long term, focusing more on prevention and focusing on re-enablement, and indeed, as I say, trying to ensure that we take the pressure off the acute hospitals so they carry out the work more quickly on those patients that need the operations and the medical care, and that we actually work together with the primary care sector, with the community sector of the NHS, to ensure that people stay out of hospital or get out of hospital more quickly. Any other questions at all? Okay, you've got the recommendations on page 57 at paras 2 and 3. Are you all in agreement?
Yes.
Thank you very much. Moving on this occasion correctly to agenda item 8, the annual report of the Director of Public Health, tackling environmental factors is vital to address obesity in Hampshire.
Good morning, Leader. Many thanks. So I present this report to you, and the purpose of the report is to present the latest of my Director of Public Health annual reports ahead of its final publication. And this year, the report really focuses on tackling environmental factors to address obesity in Hampshire, and looking at how those factors really play into tackling excess weight amongst our population. Obesity is one of the most serious public health issues we have in Hampshire, and we know that a number of people with overweight and obesity issues were put at serious harm and increased risk from COVID. So a really important issue and really pertinent at this time. This report really considers those factors and innovative case studies around key areas around the environment, so that we move away from the individual to the population approach. Both are really important, and we need to do those together so that we can facilitate and encourage and enable people to have a healthy weight. There are a number of chapters in the report, one around how our food environments shape the way we are living. The second one about active environments and neighbourhood spaces, so thinking about how we move through the environment. The third one is around learning and play environments, and those that shape what our children do and how that impacts on how they and their weight. And finally, we need to do this in partnership with others and think about how we work in partnership to shape places and the environment to tackle excess weight and really improve the healthy weight of our population. So the Cabinet is asked to note the annual report and endorse the recommendations which are set out in paragraph 3, which are my recommendations from the report. Very happy to take any questions, Leader.
Simon, thank you very much. Councillor Gruevski, Judith, do you want to comment at all before I ask other Cabinet colleagues if they have anything to ask?
Yes, thank you, Leader. I would, and I have quite a lot to say, because this report is incredibly timely for reasons that Simon's alluded to. Can I begin by thanking Simon for his report? I'm not sure how he's found the time to write it, but given what we now know about the COVID pandemic, it's brought the issue of obesity into sharp focus. The report is also timely because it ties in with the obesity strategy policy paper issued by the government last July. Obesity is a risk factor for so many diseases, many of which are life limiting. 2/3 of our county's population. So it is important we take a broader approach rather than just concentrate on the individuals we tackle the programme. We're already funding direct interventions. Last November, I approved up to £2.29 million to be spent on the Tier 2 weight management support service, and we're facilitating Sorry.
Do you want to switch off your camera, and that might improve things?
Hang on a minute. Just a minute. Yeah, hopefully that's a little bit better.
Yes, that's better.
Right, okay. So I just mentioned the £2.29 million that I approved last year to be spent on the Tier 2 weight management support service, and we're facilitating interventions through well-person checks that people have at their GP surgery. And last week we launched the Hampshire Community Champions programme, which aims to enable local people to support their communities, particularly men, to encourage them to adopt healthier lifestyles, including losing a bit of excess weight. But we have got to do an awful lot more, because obesity can reduce life expectancy by up to 9 years. And we need to extend our approach beyond the direct interventions. And I'd just like to pick out a couple of themes from the paper. Firstly, we've got to tackle obesity in children by working with schools and families. A child who is obese at 10 is likely to be an obese adult at 50. And already we're seeing, I think, in the population, children presenting with medical conditions that one wouldn't expect to see well into adulthood. And so we've got to reverse that trend. And secondly, we've got to create the right environment, both the green environment and the facilities on offer where people live, to enable people of all ages to be able to make healthy choices when it comes to how they move around and where they exercise, what they eat. Which is why I think that the boroughs and the districts have an important role to play. Local planning, I think, has got to incorporate measures in new developments, and I believe that many are, to create opportunities for walking and cycling and create green space for exercise. And I think local authorities can also intervene when it comes to the location of takeaways. You've probably read in the report that these are clustered in higher densities in areas of deprivation, further exacerbating health inequalities. The report talks about the Whitehill and Borden project, which I'm sure we're all familiar with, where a design from scratch has been bold in incorporating the elements people need to lead long and healthy lives. But I think we've also got to look at existing communities. For example, Last year, Public Health worked closely with Councillor Humby's department on active travel with government funding to implement COVID-19 schemes. And I think we've got Rob will correct me if I'm wrong, a further £3.45 million to deliver more schemes. And we're continuing to work with ETE on the public transport strategy. And I think we've got to create the right opportunities and conditions so that when people want to exercise close to home, they can. So they can walk safely to work if they want to. And it may be as simple as creating more pocket parks in existing urban areas, or it could be larger initiatives. For example, and I know this is outside the county, but in the centre of Manchester, they announced last December that they'll be creating the first new municipal park for over 100 years, since Victorian times. 6.5 acres of a 14-acre brownfield development right in the heart of the city. So in summary, I welcome this report and have no hesitation in endorsing the 6 recommendations at paragraph 3, because I think if we do get to grips with obesity and tackle it successfully, the benefits are going to be far-reaching. Thank you.
Thank you very much indeed, Judith. Questions? Steve.
Yes, one to Simon. First class report, thank you. How will you turn the report from being a worthy document into a programme of action?
Thank you very much, Councillor Reid. So you're right. So my public health annual report is really a call to action each year on a specific topic. It's as Councillor Grevsky said, it's something that as a Director of Public Health I'm concerned about, and we've highlighted this report this year. But following the government's announcement of kind of an obesity call to action in the summer, we are developing our own local obesity strategy, which in time, or healthy weight strategy, probably more appropriately called, which we are developing. Apologies, it has been delayed because of COVID workload, but we are developing that over the next few months. So hopefully in early summer, we'll be able to bring back a report about our approach to healthy weights in Hampshire, which will take on board these recommendations and other evidence going forward.
Thank you.
Other questions? Well, Simon, thank you for your report. The recommendations are on page 73 and 74, paras 2 and 3. Are you all in agreement with those recommendations?
Agreed.
Thank you very much. Moving on and staying with you, Simon, for item 9, agenda item 9, public health strategy annual, public health strategy annual update.
Many thanks, Leader. So this report is to update the Cabinet on the progress made on our public health strategy, which was signed off by the then executive member, Councillor Stallard, in 2016. I just have to say at this point, the report does cover 18 months because of the delays due to our workload in COVID. We've brought 2 reports together, so slightly delayed, and I apologise to Cabinet for that. But the report sets out really good progress we've made against our council's strategy, and we are moving forward. And with COVID, it's highlighted some of the stark differences in health outcomes, and that's a thread throughout the report. The report is based on the 5 areas of the strategy, and I would just really like to highlight to Cabinet some of the key successes we've had in this time period. So if we start about making healthy lifestyles the norm, so thinking about, as we just talked about, healthy weight, smoking and other things, we've really had a good focus on physical inactivity, and those populations are less likely to be active. I was a keynote speaker at the PE conference alongside Francis Benali, I think he's a bit more famous than me, focusing on the inactive populations in Andover and Rushmore. And as we just talked about, we have been working with Councillor Humby's department around influencing environmental factors and how we really support people to be active. Furthermore, we've done a lot of work on smoke-free, so enabling people to give up smoking, and done a lot of work around kind of quit for COVID. Really important we enable people to give up smoking. We've got a strong smoking cessation service, but also those wider things we do around smoking in terms of smoke-free environments. When we move on to good emotional health and wellbeing for all, we've got a very good substance use service, which has continued to perform well with service adaptations during COVID. It has been challenging, but we have moved that forward and we continue to perform well in comparison with our neighbouring authorities. We've been transforming our sexual health services and have received additional funding now for pre-exposure prophylaxis for HIV, so enabling those people to have healthier sexual health. And finally, but really importantly, our work on mental health continues. Done a lot of work with our partners and with our colleagues to really promote mental health and well-being. And that follows the signing of the Prevention Concordat we did earlier on, and really ensuring that we're all moving forward. I think this will be a really strong piece of work as we move forward out of the pandemic. So thinking about, and we've also got a lot of work taking place on suicide prevention, one of the sad tragedies that sometimes occurs, and we've got a lot of work and we've got a lot of investment from NHS England to do some work on suicide prevention, which is really positive. Thinking also about bereavement, which we were able to adapt during COVID to think about bereavement services in general. With regard to resilient and healthy children and young people, we've really scaled up our work on health and education settings to enable schools and colleges and others to really promote health in line with the new PSHE, Personal Social Health Education guidance that is out. And we've got our new Healthy Child programme, which we launched in the summer, and the new 0 to 19 health visiting school nursing service. On making local places healthy and safe, we've done a lot of work with our domestic abuse services, really highlighted through the pandemic of the and lockdown of the challenges there. We've seen an increase in referrals, and we've done a lot of work to develop new approaches there. And I continue to provide leadership to the Violence Reduction Unit for Hampshire, so that we can take a coordinated approach for the Violence Reduction Unit. And one of the things we are signing off next week is a programme in Hampshire hospitals to look at how we prevent young people's violence. Continue to work with the NHS. It's important that we all play our part. Finally, protecting us from harm. I think this role of public health has come right to the fore during COVID, but this is a role we carry out continuously. So we've got immunisations and screening programme, and we've really focused on our MMR uptake, thinking about we've had some measles outbreaks, and we've seen success there in increasing our immunisation rates. And as I said, our emergency planning role can't be missed this year, but we've continued to develop emergency plans around extreme weather and many other events where health and the health of the population will be impacted. And not least our work with, again, ETE colleagues on the climate change and the air quality agendas, which remain really important public health issues, both in themselves and actually how we think about things like active travel, which will impact on both climate change and on our health of the population. So the recommendations I ask Cabinet to look at are noting the continued progress and support the continued implementation of the strategy across the Council with our partners and the wider economic system, and note that the future public health strategy, as we enter the last year, provides us an opportunity to ensure the public health issues starkly highlighted by COVID are included more fully, and we take that approach. Thank you very much, Leader. Happy to take questions. You're muted, Councillor Mann.
May I comment now, please?
Yes. Sorry, Judith, have you any comments before I...
Yes, I have. I'll be fairly brief because Simon's, I think, drawn out a number of the salient points, and I want to thank Simon for his report and commend the whole department for their continued commitment to delivering the public health strategy alongside what's been an almost 24/7 effort on the COVID work they've been doing. Simon's already mentioned the Mental Health Prevention Concordat, which I signed at the end of 2019 alongside Councillor Fairhurst and Councillor Stallard. But, you know, we were focusing on mental health then. It was a priority, and it's still a priority, as Simon has said. And there are some people experiencing poor mental health as a result of the pandemic for the first time. Secondly, at paragraph 3.6, it talks about the increasing use of digital technologies, which have enabled us to reach more people and optimise the use of our limited budget, getting more bang for our buck, to coin a phrase. And this has been important during the pandemic because using digital technology has enabled services which would normally happen face to face to continue, albeit in a different format. And finally, you'll see throughout the report referencing to the strong working relationships. And I think it was Councillor Reid who said earlier, about Simon's annual report, how we're going to deliver this. It is through those strong working relationships that exist both across the county council's departments and with partners outside the council. Strong partnership working with the boroughs and districts, the NHS, CCGs and our commissioned service providers, charities, voluntary groups, housing associations and lots more have been key to delivering the aims of the public health strategy. So I want to thank colleagues here and beyond the council for their shared enthusiasm for making this happen. Thank you.
Thank you, Judith. Any questions for Simon? Patricia.
Thank you, Leader. I'm sorry, it's not a question, but I couldn't let this opportunity go by without saying another thank you to Simon and all his team for all the work that they do with children's services and young people. Their contribution is absolutely invaluable, and they've done so much work with the school nursing programme, the sexual health services, the substance misuse, the mental health. I could go on with a long list of things that they have done to help to support our children and young people, and I would just like to record my thanks to everyone. Thank you.
Thank you, Patricia. Any other comments or questions? Okay, are you happy therefore with the recommendations on page 103, paragraph 2? I see no dissent. Those recommendations are approved. Moving on to item 10, the Waterside Transport Strategy update. And I'm just checking, Stuart, is Stuart giving that or is Keith Wilcox giving that?
It'll be me, Leader.
Oh, that's fine. Good.
Good morning, members. This report is essentially an update on an important transport strategy area for the County Council relating to the waterside communities alongside Southampton Water. The report sets out to update members on progress on a number of the component parts of that overall transport strategy, and I'll take you through them very briefly. The report also seeks decisions to add additional programmes into the County Council's capital programme, which require Cabinet approval, and it seeks Cabinet approval to a continuation of the exceptional payment arrangements for the ferry service at Hythe, and by extension also to the Gosport ferry, which is suffering the same issues. Leader, I know you and Cabinet members are very familiar with it, but of course, since the report was drafted, we've had a decision on the Freeport application for Southampton, or for South Hampshire, which includes a significant component of the Freeport proposals in the Southampton waterside area. And I think this just highlights the relative significance of that area economically to the recovery, but also it highlights how important infrastructure improvements will be to deliver the vision for a thriving Freeport area, and not least among those would be improvements to the northern section of the A326 main road there, with the potential for improving access to some of the sites along the waterside where the new development is expected to take place, not least as well the Fawley waterside development of the former power station, which is hopefully in the advanced stages of completing the Section 106 agreement and seeing planning consent issued there in the next few weeks. And I think the Freeport announcement is a long way to go. We're still working through the detail with government officials, but it's a really exciting opportunity and very good news for the area that South Hampshire was included in the overall government programme announced in the budget. The large majors project bid for the A326 northern section, there's due to be a consultation with the public in the spring and summer of this year, following which a strategic outline business case will be submitted to the government, which will hopefully then move that scheme forward. And the fact that it coincides with the Freeport designation, one can only hope would give added impetus to the possibility of including that area in government future infrastructure investment plans. The report also focuses on the waterside railway line and the potential for reintroducing passenger services on that line, which is currently only used for occasional freight services to the Marchwood military port, with the service to the refinery having ceased a few years ago. Since the County Council last considered this matter, the circumstances are felt to have changed around the waterside area, and in particular the new development opportunities that are now coming forward, and also the fact that government have set up a dedicated funding pot aimed at reintroducing passenger services onto railway lines that have previously not had passenger services on. The report highlights the improved potential there for the reopening of the waterside line for passenger services. It also seeks authority for us to continue to work with Network Rail and other relevant partners to progress that scheme, and seeks a statement of support from the County Council conditionally for the reintroduction of passenger services, recognising that there are lots of benefits, but there are also impacts which would need to be worked through and mitigated, not least the likely attraction of a significant part of the new passenger patronage from other forms of public transport, and therefore it will be important to look at working with the government to mitigate the worst impact that might have, for example, through reconfiguring bus services in the area. There is also, of course, the potential impact on the level crossing at Totton, which is already a significant traffic bottleneck problem. And again, the scheduling of new services will be a very important consideration in that. The report also seeks to add 2 cycling and pedestrian schemes to the capital programme, both of which have been subject to recent additional funding receipt from the County Council. One of them is improved pedestrian and cycle facilities over Redbridge Causeway, for which we've received a very welcome government funding announcement at the end of January, which will allow us to top up the Transforming Cities Fund work that was already due to take place in the area and bring forward a more comprehensive and therefore a better scheme for cyclists and pedestrians at Redbridge Causeway. The report also seeks approval for the East-West Connectivity Project, which again is an important development building on the existing A326 South programme of junction improvement. And this will increase amenity and improve facilities for cyclists and pedestrians. And this is particularly important as it helps to link the waterside communities with the New Forest area, where otherwise the road system can act as a severance and a barrier to better movement by pedestrians and cyclists. I think the project will be largely welcomed, and these measures have been brought forward in addition to the junction improvements already planned, partly in response to the consultation responses we've seen and received from the public in that area, and partly to give full effect to the change in cycle design guidelines issued by the government in the summer. Finally, with the report, authority is sought to continue during the time of the current national lockdown with the exceptional revenue-based payment to the ferry service at Hyde and Gosport in recognition of the reduced passenger numbers during the lockdown. The ferry services are struggling, as all public transport has, with reduced patronage, but to date the government funding has not really been there to the same extent for ferries that it has for rail and bus services. Whilst I think the ferry companies would obviously seek to get additional funding in, it's felt that the County Council should contribute a further round of funding in the same way and on the same basis that we did during the previous lockdown, conditional upon the other local authorities involved with each of the ferry services also contributing, which we believe they will, but the County Council's contribution is conditional on that. The recommendations are set out on page 121 and 122, which cover all those points, Leader, and that was all I proposed to say by way of introducing the report.
Thank you very much, Stuart. I will ask Rob Humby to make a comment in just a minute. I should have probably mentioned the Freeport in my introductory remarks. I think what's important about the Freeport is there's two elements to it. There's the free customs zones, which effectively mean that the ports of Southampton and Portsmouth can operate as entreports without the goods actually coming into Britain. A good example of that is the importation of motor cars bound for the continent from other parts of the world, such as South America, I understand, in terms of the BMW company, would come into Southampton, not be imported into this country, and then be able to go straight on to the continent via Rotterdam. That's the customs points. The other important element are the taxation points. And two of the three taxation points, which allow effectively what I would call super enterprise zones, two of the three are totally in Hampshire, the county of Hampshire, rather than the two cities. And a fair chunk of the third one, which is based on in Redbridge in Southampton, but also includes parts of the waterside, is also in the county of Hampshire. So despite the fact it's called a free port, the effect on the county as opposed to the two cities in terms of regeneration and recovery is probably greater, provided this particular scheme goes ahead. Hence the fact that it's very important for the county to take a leading role in this, because the effects of the extra economic activity goes well beyond the ports themselves, and indeed in many cases well beyond the county in terms of the links with the Midlands, for instance, and the car manufacturing in that particular part of the country. So I would argue the Freeport is of significant importance to the whole of the county. But Rob, you've probably got something much more detailed and relevant to tell us.
Wouldn't possibly say that, Chairman. Just to add, I mean, Stuart's covered it all. I'd like to thank Stuart and all his team for putting this report together. It is an update, and it says what it says, you know, multimodal transport strategy, and that's exactly what it is. It deals with all the schemes we're looking at in terms of road, rail, bus, and the ferries. So it brings all those different parts of that into this report, and the significance of that to this area. And I was going to mention Freeport, but you've covered that, and how important this report is to not just the waterside area, but for the whole of Hampshire and the implications for that. I think one thing to note, I'd also, Chairman, that you've been supporting as well, is the support that you've previously given to the ferries, and it's in the recommendations 8, that we're looking at to continue to support the Hythe ferry and the Gosport ferry, but with agreement of match funding from the other authorities as well. And I think that's really important that you have done that previously, and we will continue to do so if we can get that agreement with the other authorities. So really, I think it's an excellent report. There's a huge amount of work that's gone into this, and the significance, as I say, for the benefits right across Hampshire, not just for the waterside area. So thanks again to Stuart and his team. Thank you, Leader.
Thank you, Rob. Steve.
Yes, thank you, Leader. I just want to commend this report and agree with everything that Stuart has said. I think that what this report is doing is positioning Hampshire County Council to help lead the recovery after the COVID lockdowns. We've got to keep the infrastructure going, and we've got to maximise our economic opportunities so that the jobs come back and economic activity gets back to normal as quickly as possible. And in that context, I fully agree with the initiative you've taken, Leader, to go along and talk about the need to extend the runway at Southampton Airport, which I think will be absolutely critical for the economy. The only question that I would ask is if there are any similar opportunities in the north of the county, for example, around Farnborough International and other transport links, where we could maximise the recovery for the whole of Hampshire.
I don't know whether that's directed at me or you, Stuart. The answer to your question as regards Farnborough is, I think the work that's been done already in terms of getting the Gulfstream company to base their European operation in our county is going to be of significant benefit in terms of encouraging inward investment from the international community, because when you're the boss of a large international company and you want to come to Britain, you probably come via Farnborough, and therefore we're in a pole position to ensure that when they arrive at Farnborough looking towards providing inward investment, they stay in Hampshire and don't go outside it in making their decision. But Stuart, you may want to add something to that, I don't know.
Just very briefly, if I may, Leader, it's recognise Councillor Reid's identifying Farnborough as an important economic asset, and to reassure him that yes, there is a package of transport improvements for Farnborough, including a proposed improvement scheme at Lynchford Road, which will help to increase and improve accessibility to the airfield area and the important commercial activities that go on there. So absolutely there is, but it didn't form part of the Freeport bid, but it's nevertheless been progressed through other means.
Excellent, thank you.
Thank you, Stuart.
And Leader, if I may comment just on Stephen's point, in terms of the Freeports, of course, that can be a benefit to the whole of Hampshire. When you look at the job creation and out a lot of those businesses that will be involved with that, it's not just that area, it is the whole of Hampshire that will benefit from this bid.
Great. Any other questions? Are you happy with the recommendations? Councillor Herron.
Chairman, thank you. I'm going to abstain on this one, thank you.
Yes, I understand. Okay, the recommendations are on page 121, 122, paras 3, 4, 5, 6, 7 and 8. I see no hands up, so those recommendations are passed. Thank you very much. And we now go on to the final item, which is item 11, update on the Celix grant. John Cogland.
Thank you very much indeed, Leader. I'm covering this report in the absence of Felicity Rowe. So members will recall that in the capital programme that was brought before Cabinet and full council recently, we were very pleased to be able to report that we'd won a 20 million grant from Celix amongst a range of other grants from Celix to support double glazing replacement in schools. Since then, there's been a technical issue between ourselves and Celix. It would appear that an error had occurred in a very complicated equation that they use to measure the relationship between window space and floor space related to carbon outputs. And because of that error, which is was found by Celix's own due diligence processes, and was based upon the way they'd advised us, unfortunately, the grant award that we received will be reduced from 20.2 to 16.9 million. So we need to record that amendment here. We've still won £17 million for this important project, but sadly it's slightly less than originally intended. So one of the other functions of this report is to seek agreement for the gap between the actual cost of the replacement up to a maximum of 3.27 million should be covered off through use of the school's condition allocation grant funding in order to make sure that we can work to the full amount of the original project that we bid for. I am advised, however, that it's quite possible that with the quality of our procurement processes that we might come under the original price anyway, and therefore the level of underwriting will be less than it was. So we regret that we've got slightly less in this award than we had anticipated, but we're still winning 17 million alongside another 12 million or so of additional Celix grants which aren't touched by this very specific accounting problem. I'm very happy to take questions, members.
Thank you, John. Any questions for John?
Well, if I could just make a comment, Leader, because I think my battery's gone in my mouse. I don't think that this adjustment should undermine two major facts. The first is that all the schools that we were planning to do will be done. And the second is that our team has done brilliantly in taking schemes off the shelf and qualifying for these grants, and their performance has been exemplary. So this is, I don't want any negativity to creep into this subject because it's an extremely positive story overall.
Thank you, Stephen. Any other comments at all? So are you all happy with the recommendations on page 135, paragraph 2, I think it is, yes. I see no hands. Okay, thank you all very much.
Thank you.
That ends our cabinet meeting. And Kevin, I'd be grateful if you would switch off the webcast.